You're still hitting the gym in Lake Mary, but your energy is gone. You're losing muscle even though your training hasn't changed. Low testosterone creeps in slowly, and most men don't connect the dots. Persistent fatigue, brain fog, and weight gain around your midsection don't just happen by accident. Your testosterone drops about 1% every year after age 30. Stacking those symptoms together tells a different story than any single lab result. At Svelte Medical Weight Loss in Lake Mary, we run a full hormone panel: free testosterone, SHBG, estradiol, thyroid markers, and metabolic indicators. One number on a lab page doesn't tell us enough. Your symptoms and your blood work together tell us the real picture. Your first visit includes a blood draw and a full review of your health history and symptoms. Lab results come back within a few days, and we walk through every number with you. Most men go from first visit to first dose in about 2 weeks. You can choose weekly injections, a daily topical cream, or subcutaneous pellets placed under the skin every 3 to 6 months. In Florida's heat, heavy sweating affects how well topical gels absorb through your skin. We match the delivery method to how you actually live your life. We track your hematocrit, PSA, estradiol, and testosterone levels every 3 to 6 months to keep your dose dialed in. Your energy, muscle, and mood depend on consistent monitoring, not a prescription that gets forgotten. Call Svelte Medical Weight Loss in Lake Mary and book your first blood draw today.